Things to do during pregnancy. Get plenty of rest. Getting plenty of rest is important for any pregnant woman, as it can help her to stay healthy and energized. It can also help her to feel more relaxed and reduce stress, which can be beneficial for both mother and baby. Some tips for getting plenty of rest during pregnancy include: 1. Take frequent naps during the day, if possible. 2. Go to bed at a reasonable hour and set a regular bedtime and wake up time. 3. Avoid caffeine and alcohol, as they can interfere with sleep. 4. Avoid activities that can be physically or mentally draining, such as watching television or using the computer late at night. 5. Make sure your bedroom is comfortable, quiet, and dark. 6. Keep the temperature in your bedroom cool, as this can help you to sleep better. 7. Talk to your doctor if you are having difficulty sleeping. Exercise regularly. Exercising regularly during pregnancy is a great way to stay healthy and active. It can help to reduce pregnancy-related aches and pains, increase energy levels, and help with overall well-being. It can also help reduce the risk of gestational diabetes, preeclampsia, and excessive weight gain. When exercising during pregnancy, it is important to consult with your healthcare provider to ensure safety and to ensure that you are engaging in activities that are appropriate for your stage of pregnancy. Additionally, it is important to listen to your body and make modifications to exercises as needed. Good exercises for pregnant women include walking, swimming, and light strength training. Low-impact exercises, such as yoga and Pilates, are also great options. It is important to avoid activities that involve contact or have a high risk of falling. It is also important to stay hydrated and wear comfortable clothing. Eat a healthy diet. A healthy diet during pregnancy should include a variety of foods from the 5 main food groups: fruits, vegetables, grains, proteins, and dairy. Eating a variety of foods from each group will ensure that you get the essential nutrients for both you and your baby. Aim to eat a balanced diet that is high in fiber, vitamins, and minerals, and low in saturated fats, added sugars, and sodium. Fruits and vegetables. Aim for 5 servings of fruits and vegetables daily. Choose a variety of colors and types to ensure you get the necessary vitamins and minerals. Grains. Choose whole grains, such as oats, barley, quinoa, or brown rice for added fiber, B vitamins, and minerals. Proteins. Incorporate lean proteins, such as skinless poultry, fish, beans, and legumes into your diet. Dairy. Choose low-fat dairy products, such as yogurt and cheeses for calcium, protein, and other essential vitamins and minerals. Stay hydrated. The amount of water you need depends on a few factors, such as how much you exercise, the climate you live in, and your overall health. Generally, it is recommended to drink 8 to 10 glasses of water per day. It is important to stay hydrated, as it helps reduce swelling, constipation, headaches, and fatigue. It can also help flush out toxins, improve digestion, and keep your energy levels up. Additionally, it is important to avoid dehydration, as it can lead to preterm labor, low amniotic fluid levels, and other complications. Make sure you drink enough water throughout the day and sip on water throughout your meals. It is also important to avoid sugary drinks and alcohol, as these can be detrimental to your health and your baby's health. Take prenatal vitamins. Prenatal vitamins contain essential vitamins and minerals, such as folate, iron, calcium, and vitamin D that the developing baby needs to grow and develop. Taking prenatal vitamins can help reduce the risk of some birth defects, such as neural tube defects. Prenatal vitamins can also help support the mother's health during pregnancy and reduce the risk of certain maternal health issues, such as anemia. It is important to discuss taking prenatal vitamins with a healthcare provider to determine which type is best for a particular pregnancy. Connect with your baby. One of the best ways to connect with your baby during pregnancy is to talk to them. Speak to your baby in a soft, gentle voice, and express your love for them. You can also play music and sing to your baby, as they can hear sound from inside the womb. Massage your belly and rub it in a gentle, circular motion, as this will help to stimulate them. Take time to bond with your baby by reading stories, listening to music, and taking walks. Finally, take time to meditate and focus on the positive aspects of your pregnancy. Visit your doctor. It is important to visit your doctor throughout your pregnancy. The frequency of visits will vary depending on your health and any complications you may be experiencing. Generally, you will have an initial visit within the first 8 weeks of pregnancy, followed by visits every 4 weeks until 28 weeks, then every 2 weeks until 36 weeks, and then weekly until delivery. During each visit, you will have your weight and blood pressure monitored, urine tests, and may have other tests, such as ultrasounds. You may also discuss any questions or concerns you have about your pregnancy. Be mindful of your stress levels. It is important to be aware of your stress levels during pregnancy, as elevated levels of stress can have a negative impact on both the mother and the baby. Stress can lead to a range of physical, emotional, and behavioral changes that can be harmful to both mother and baby. It is important to take measures to reduce stress and practice relaxation techniques, such as deep breathing, yoga, and meditation. It is also important to reach out to family, friends, and healthcare professionals for support if needed. Look into childbirth classes. Childbirth classes are designed to help pregnant women and their partners prepare for the labor and delivery process. During the classes, topics such as stages of labor, pain management techniques, medical interventions, relaxation, and breathing techniques, and postpartum care are discussed. In addition, classes may include information on newborn care, breastfeeding, and nutrition. Some classes also offer a tour of the hospital or birthing center where you plan to give birth. In addition to providing valuable information, childbirth classes also offer expectant parents the opportunity to meet other couples who are also expecting a baby. Most classes are taught by certified childbirth educators and are available in person or online. Things not to do during pregnancy. Avoid drinking alcohol and smoking. Drinking alcohol and smoking during pregnancy can have serious consequences for both the mother and the baby. Drinking alcohol can cause physical and mental birth defects, including fetal alcohol syndrome, FAS, and can increase the risk of miscarriage, preterm labor, and stillbirth. Smoking during pregnancy has been linked to low birth weight, premature birth, and other health problems. It can also increase the risk of sudden infant death syndrome, SIDS. Therefore, it is recommended that pregnant women avoid drinking alcohol and smoking during pregnancy. Avoid contact with cat litter and cat feces during pregnancy, as these can contain a parasite called Toxoplasma gondii, which can cause serious health risks to the unborn baby. The parasite is found in the feces of infected cats and can be spread through contact with contaminated soil, water, and unwashed vegetables, as well as contact with cat feces. Pregnant women should take extra precautions to avoid contact with cat litter and cat feces, including wearing gloves while cleaning the litter box, avoiding contact with stray cats, and washing hands after contact with cats or their feces. Refrain from taking any medications, including over-the-counter drugs, without consulting your doctor during pregnancy, as many medications can be harmful to an unborn baby. Some medications can cause birth defects, increase the risk of miscarriage, or cause other problems for the baby. Therefore, it is important to discuss any medications, including over-the-counter drugs, supplements, and herbal remedies, with your doctor before taking them during pregnancy. Your doctor can advise you on the safety of specific medications and help you make decisions about what is best for you and your baby. Avoid hot tubs, saunas, and tanning beds. Hot tubs and saunas can cause an increase in body temperature which could be harmful to the baby. Tanning beds can increase the risk of birth defects. Additionally, tanning beds can cause dehydration, which can be dangerous for pregnant women. Avoid eating raw or undercooked meat, fish, eggs, and unpasteurized dairy products. Raw meats and fish may contain harmful bacteria, such as Salmonella, E. coli, and Listeria. These bacteria can cause food poisoning, which can lead to serious complications for you and your baby. Undercooked eggs can also contain harmful bacteria, such as Salmonella, which can cause food poisoning. Unpasteurized dairy products, such as raw milk, can contain bacteria such as E. coli and Listeria, which can also cause food poisoning. It is especially important to avoid these foods during pregnancy, because the risks to you and your baby are greater. To reduce your risk of food poisoning, make sure to cook all meats, fish, and eggs thoroughly. Avoid unpasteurized dairy products, and always use pasteurized dairy products. Avoid activities that could cause injury, such as contact sports, horseback riding, skiing, and scuba diving. Pregnant women are encouraged to participate in low-impact activities, such as swimming, walking, and yoga. It is also important to speak with your healthcare provider before engaging in any form of exercise during pregnancy, as some activities may not be suitable for pregnant women. Avoid eating certain types of fish, such as shark, swordfish, king mackerel, and tilefish, which may contain high levels of mercury. Avoid traveling to areas where certain infectious diseases are common. Pregnant women avoid traveling to areas where certain infectious diseases are common. These diseases can include malaria, Zika virus, chikungunya virus, and dengue fever. It is also recommended to avoid areas with high levels of environmental pollutants and poor sanitation, as these can increase the risk of infection. Additionally, pregnant women should also avoid consuming food and beverages that may be contaminated with bacteria or parasites that can cause illness. Finally, pregnant women should always discuss travel plans with their doctor and get the appropriate vaccinations and medications before they travel. Avoid exposure to hazardous chemicals, such as pesticides and cleaning products. Pregnant women should take extra precautions when handling these chemicals and should avoid exposure to them as much as possible. If exposure is unavoidable, pregnant women should use protective gear, such as gloves, an apron, and a face mask. It is also important to ensure that any chemicals are stored in a secure and well-ventilated area away from pregnant women. Additionally, pregnant women should avoid using any products that contain strong fragrances or chemicals, such as bleach and ammonia. Avoid handling or eating food that may contain harmful bacteria, such as unwashed fruits and vegetables. Eating contaminated food can lead to food poisoning, which can be dangerous for pregnant women and their unborn baby. Pregnant women should also avoid eating raw or undercooked meats, eggs, and fish. Instead, they should opt for cooked foods that are free from bacteria, such as canned or frozen fruits and vegetables. It is also important to wash all fruits and vegetables thoroughly before consuming them. Finally, pregnant women should make sure to practice proper food safety and hygiene, such as washing hands and surfaces after handling food. Thanks for watching. Please like, share, comment, subscribe and click the bell icon to get new video updates.